One state lawmaker is proposing Rhode Island allow harm reduction centers for those who have substance abuse issues. Included in the bill, the creation of safe injection sites where people can use drugs. Eyewitness News reporter Anita Buffoni spoke with the senator who introduced the bill. She joins us now live in studio with those details. New at 5:30. Anita?
Well, this is all part of an effort to prevent drug overdose deaths. While critics say these harm reduction centers, sometimes called safe injection sites, would encourage drug use and lead to overdoses, one recovery services organization says there is data that shows otherwise. Project Weber Renew is an organization dedicated to helping people who are struggling with addiction.
A person has to be alive in order to enter recovery.
Colleen Daly-Andoy says the road to recovery may begin at harm reduction centers where medical professionals are available to prevent overdoses from happening. She says if people are going to use illegal drugs, it should be in a safe space where other resources are available to them.
They could come in to consume, and then they could get an opportunity to get an HIV test or a Hep C test or connect to a doctor or connect to medical services. And so we see it as an attempt to connect people who might be disconnected from other services.
A bill introduced in the Senate is calling for a pilot program to create these harm reduction centers overseen by the Department of Health. Senator Joshua Miller is the lead sponsor. He uses Canada as an example where he says they have these centers with no reported overdose deaths.
There are no increase in use. There's a reduction of crime in the area. So everything seems to be beneficial where they do exist and where they have existed for over a decade.
Miller says many overdoses, especially involving fentanyl, are accidental.
If they can use in a safe setting where they're supervised by medical staff, we would avoid those.
Now, Massachusetts has also proposed supervised injection sites. Last year, a similar bill introduced by Senator Miller passed the full Senate but died in the House. He says there is a lot of momentum in the General Assembly on this issue and hopes it will pass this year. I'm Anita Buffoni, Eyewitness News.